Welcome, everyone. My name is Charlene Margot, and I'm the co-founder of nonprofit The Parent Venture that brings you the Parent Education Series. Tonight, we have a very special town hall meeting hosted by Sequoia Healthcare District. Since February is American Heart Health Month, this event could not be more timely. So we're delighted to bring you tonight's program, Celebrating Heart Health Month, COVID-19 Implications for Heart Health. Everybody, do you mind muting yourself while we're talking? That would be great. So tonight, again, is a meeting format for this town hall. We really want to hear from you, the audience. We're so glad that you're here with us tonight. So we have a program planned for you with 4 panelists, and then there will be a Q&A section at the end. Since this is a Zoom meeting, by now most of you are probably familiar with the format. We have a chat button. My co-founder, Bev Hartman, will be putting resource links and other information in the chat. Feel free to communicate with one another or with us. And we'd also like you to put your questions in the chat. So again, comments, resource links, and questions in the chat. We'll be reviewing those as the night goes on. And then after the presentations, we're going to open it up to you, our attendees and community members, and other nonprofit leaders. So glad to have you here. We see some familiar faces. It's just really lovely to have you with us. Tonight's event is going to be recorded and will be available shortly on our video library, which is sponsored by Sequoia Healthcare District in partnership with the Boys and Girls Club of the Peninsula. And now to tell you a little bit more about Sequoia Healthcare District, I'd like to introduce you to Pamela Kurtzman, the CEO.
Thank you, Charlene, and thank you everyone for joining us tonight. I wasn't going to spend too much time on introducing the district. I think a lot of familiar faces are here tonight. We have a lot of information about the district on our website, and Bev is going to put that in there. I'll take a minute to just say some of our biggest priorities during COVID is helping our community to recover from this pandemic, get our folks back on track health-wise, economic-wise. We're partnering with multiple community agencies to help support the health and well-being of our district residents. We just had a new census, and our residency has grown by another 20,000. And we hear that there's this mass exodus out of San Mateo County, but we haven't seen that. We're seeing growth, and our mission continues to be to support the health of our district residents amidst this new challenge as well. And heart health is always at the forefront of the work that we're doing. And I want to start by introducing 2 of my staff who are here tonight. Jenny Bratton, she's our Director of Grants and Programs, and literally my right arm. And thank you for helping to organize this event tonight, Jenny. And Luz Garcia, she's our newest member. She's been with us for about 6 months. And she handles our Sequoia Strong program and is revitalizing that program. So if you do get on our website, and please do go to sequoiastrong.org, and you'll see some of the fantastic resources that we have there. Literally all kinds of resources, from prenatal health to senior care and even hospice. So the whole gamut. And Luz also handles our communications. And so I also will introduce you to our board director and presenter tonight, Kim Griffin. Kim is a nurse, a pediatric nurse, and you'll hear more about, we'll tell you about her bio shortly. We look forward to hearing from Kim. And then Erica Lyons, she does all of our CPR. Right now she's doing it virtually. We cannot wait till we can get in person. She's an extraordinary instructor. She has found ways to teach CPR online, providing real mannequins you come and pick up. And she's been working mostly with expecting parents in the community. And I'll also introduce you to Lazar Johnson. She's one of our longtime program partners. I worked with her when I started in 2006, and she helped me launch the Heart Safe program, and she continues to be a significant partner with us today through her VIA Foundation. She maintains over 350 AEDs that we have out in the community, and she does heart screening, so you'll hear more about her as well. And I think I have introduced, did I miss anyone, Charlene? Did I? think so.
Dr. Griffin.
Well, I thought you were gonna, I'm sorry, I was thinking you
I'll
were
do
going
that.
to
I'll do that
introduce
part.
him, that's all. I was introducing our
That's
team.
okay.
I
No,
did
no.
not forget you. I'm really sorry. I'll let you do that because you're gonna do the whole bio.
Yeah.
Wonderful. So welcome again, everyone. I'm so excited you're here and look forward to a really great, informative, and fun session tonight. So I'll hand it back over, Charlene.
Thank you so much, Pamela, for that wonderful introduction. Again, since February is American Heart Health Month, this is actually our second year offering this town hall meeting on heart health and COVID-19 implications. We are so delighted to have with us a wonderful panel today. As Pamela mentioned, some of them are staff members, some of them are very closely aligned with the Sequoia Healthcare District. So tonight, we will be bringing you a wonderful panel. First of all, Kim Griffin is the former board president of the board of directors at Sequoia Healthcare District, and additionally a registered nurse at Children's Cardiology of the Bay Area. We also have with us Dr. Michael Griffin, who's a board certified physician in general pediatrics, pediatric cardiology, and adult congenital heart disease. Dr. Griffin practices at Children's Cardiology of the Bay Area. We also have Lazar Johnson, who's the founder and executive director of Via Heart Project. Via Heart Project is a nonprofit organization dedicated to the awareness, education, treatment, and the prevention of sudden cardiac arrest. And last but not least, the fourth member of our panel tonight is Erica Lyons, who, as Pamela mentioned, and she's the only one dressed properly, all in red, is the CPR instructor for Sequoia Healthcare District's infant and adult CPR classes. She's helped hundreds of local parents master hands-only CPR. So we just want to say a really warm virtual welcome for our four panelists tonight. Each of them is going to be speaking to you for a few minutes about what they're seeing in their practice, what they would recommend for us, and just some general information about heart safety and education and warning signs. So we're going to literally go down the list in the order that I read you people. So again, board member Kim Griffin, followed by her husband, Dr. Michael Griffin, Lazar Johnson, and then Erica Lyons. After everyone has had a chance to speak, we're going to open it up to you, the audience. So again, we welcome your questions. We want to hear from you. We want your participation. So please do put your questions at any time during the presentations in the chat box. Let's get started with Kim Griffin. Welcome, Kim.
Good evening, everyone. I just wanted to speak briefly about immunizations. We're still getting a lot of calls in our office about COVID immunizations, specifically about booster shots. So we are recommending COVID immunization for all of our patients age 5 and up, even our patients with complex congenital heart disease. And then also, I just wanted to reassure everyone that if they haven't already done the booster, there's really no cutoff date for that. You can still get a booster. So I would encourage everyone, if you don't have that yet for your child or even yourself, to go ahead and get that so that we can stay ahead of any variants. Because as you know, we've got a couple new variants. I believe they're called B1 and 2 that are present in the United States. Not in large numbers, but they're here. And we want to stay ahead of any variant that surges during either the summer or the fall. We can't be complacent right now. We must immunize. So boosters for children 12 through 17, they were recommended 5 months after the second booster, and 18 and older, you should get a booster after the second dose at 2 months. But again, there's no cutoff. If you didn't get that booster, go ahead and get it now because you won't be turned away for that. Currently, there is no FDA clearance for children under 5 years yet. They're still working on that, and I don't really have a projected date for that. So for kids, for anyone that had the J&J adults, they were recommended a second dose of either Moderna or Pfizer and a booster. And then my last thing that I really want to emphasize is the flu shot this year. Again, we can't be complacent. We haven't seen a lot of flu for 2 years. And there's a reason for that, because we've all been either staying at home or wearing masks, being very careful. But as you know, the flu virus is, it's tricky. Just like COVID, it wants to find a way to infect people, and it will. So this is the year for everyone to get their flu shot. So that's pretty much all I want to emphasize right now, and I'll turn it over to my boss and my better half, Dr. Griffin, who I work with, and he wants to talk a little bit about what we have seen in our office with COVID-related cardiac problems. And I would say, and he'll agree, we were quite swamped for about 2 months.
Thank you so much, Kim, and welcome, Dr. Michael Griffin.
Yes, thank you for inviting me to participate in this important event, and especially honoring the Heart Health Month. So thanks again for inviting me. I just really wanted to say a little bit about what we're actually seeing from the community. And I think the three major complaints that we see are chest pain and arrhythmias after COVID. And then also chest pain after vaccination. And then I think the third complaint would be unexplained fever after COVID. And so what I would say is it's really important to be aware that you can have chest pain that's involved with the infection following COVID. Usually initially that's, during the illness, but there are some folks that we're seeing that have myocarditis or pericarditis following the illness. I'd say though, most of the people that we see don't have that. So a lot of the younger people don't have that at all, but they're worried about it. So I think there's also a fourth thing that comes up a lot with COVID is just anxiety. I think those levels of anxiety in the community are quite high right now for all kinds of different reasons. And so I think it's a good thing to be aware of as you see and treat patients who are, either recovering from COVID or worried about it, want to know whether they should get a vaccination or a booster. In the patients after vaccination, I would say that we haven't seen too many patients at all that fit the CDC criteria for vaccination-associated myocarditis, so it is indeed rare. I think I've only seen one case that we reported to VAERS, and that was about it for the entire 2-year period. So it's exceedingly rare, and that patient pretty much self-recovered with minimal treatment. So I would reassure everybody that this is a safe and effective vaccine from a cardiovascular standpoint. And then finally, I think that the reason to get vaccinated, one of the reasons to get vaccinated besides protecting both yourself, your children, and your loved ones of all ages really, is the fact that especially in the young, but even in older age groups, you can have a post-infectious syndrome called MIS, or multi-organ inflammatory syndrome, which is the risk is dramatically reduced by getting vaccinated. And we are seeing a few cases of those. So again, that's rare, but it is something that complicates the COVID infection and could land you in the hospital and even in the ICU. So it is something that is preventable. That's about all I had to say. So if anybody has any questions or concerns, I'll be happy to answer them.
So Dr. Griffin, there is a question here about the vaccines. One of our attendees asks, what's the data around whether or not kids 5 to 11 who were just approved for the vaccine in November will need a booster too?
Well, the CDC recommends a booster. In terms of knowing the raw data on that, I don't think I'd be the right person to answer that question as a cardiologist.
Okay, thank you for that.
But all of them went through the same safety progress or safety, protocols that the adult and older patients went through. So in terms of the safety part of the vaccine approval, that was all done, with the same protocols. So I think it's passed the same tests. Some of the things that have come out, I think one of the things is that, these rare events wouldn't show up until you had about 1 million people vaccinated anyway. So, some of these things are not going to show up until later. But actually, the good news is that, lots of, millions of kids have been vaccinated at this point. And we really haven't seen an increased risk for myocarditis or any of those other things that we have seen in the 12 to 18-year age group. And that was only slightly increased. So I think it's again tells me that, one, it's safe, even in those patients who are affected. That illness, the vaccine-related myocarditis, is a very mild entity, which is brief, transient, and resolves completely, and really doesn't seem to have the same implication as myocarditis associated with any other viral infection, including COVID. So for all those reasons, I'd say you're still far better and far safer with vaccination.
Thank you for that, Dr. Griffin. When we talk to groups of parents, and we have done this recently, that was a great fear. So you've really allayed, I think, a lot of anxiety about those vaccines and their safety. There are more questions about vaccines here. I don't know whether you want to answer them or not. Here is someone asking whether the timeline for boosters for kids 5 to 11 is still the same. Will boosters be recommended, essentially? And I think you were saying yes.
Yes, yeah. I think that's data that's forthcoming. As far as I know, the boosters are only for 12 and older at this point. And the thing is that the kids get a really, really good response to the initial series. And so they're still trying to figure out what the length of time is that their neutralizing antibodies are going to be elevated enough to provide them with enough protection. And so I think that's going to be forthcoming.
Okay, thank you for that. Really, really helpful information. All right, so next we're going to hear from Lazar Johnson, who's the founder and executive director of the Via Heart Project. Again, this is a nonprofit organization dedicated to the awareness, education, treatment, and prevention of sudden cardiac arrest. Liz, let's hear from you.
Thank you so much for having me. I always love joining this panel and sharing what we do with your audience. I'm the executive director of Via Heart Project. It's a nonprofit I started back in 2010 with the goal of treating sudden cardiac arrest, both in communities and on the school campus. You may know that about 20% of the population is found on a school campus on a daily basis. You've got teachers, students, faculty, staff, you've got the custodial team, after school activities, Boy Scout troop meetings, etc. So having a way to treat cardiac arrest that happens on the school campus has been a high priority of ours, as well as in the community. And to do that, we've been teaching CPR and placing automated external defibrillators. They're called AEDs. Erica's going to be showing how to use an AED soon, but it's a very simple device that gives you the power to save a life while you're waiting for help to arrive. It's the only treatment for cardiac arrest is a defibrillator. So we have been placing those in schools all throughout the state of California since we started in 2012. Right now we have over, 2,400 AEDs that we manage all over the world. And about 900 of those are in schools in Northern California. So we do a lot of AEDs in schools. In 2016, we decided to try and create a fully heart-safe campus and prevent cardiac arrest instead of just treating it. And so we started doing youth heart screenings in 2016, where we go to a school campus on a weekend, basically take it over, and we can screen up to 700 kids in one day. We have a group of 100 to 150 volunteers that come to our events. A lot of medical people from the Bay Area have donated their time over the years. We give them a vitals check, a health history review. We give them a 12-lead EKG and review with a cardiologist and a limited echocardiogram. And in doing this, and it's all free of charge to the families. We get sponsors. Sequoia Healthcare District has sponsored some of these events in the past. We've had a few at Sequoia High School that have been very successful. And in doing so, we found over the years, we've screened about 6,300 kids since 2016, and we've found 77 at risk for cardiac arrest. And that's 77 kids that have some type of heart problem, some type of heart issue that could put them at risk for cardiac arrest. We have about 370 that we've referred for follow-up. So they have some type of issue that may not be potentially fatal, but it's something they didn't know about before. We found things like high blood pressure or asthma, Pott's disease, et cetera, at our screening events. And so I consider these pretty successful because we find about 1 in 100 kids with a heart defect or a heart issue that needs follow-up care. Cardiac arrest is the leading cause of death on a school campus, and it's the leading cause of death of high school athletes. So you get all these active shooter drills, which are very important, but also thinking about your children's heart is also very important. And so getting an EKG and recognizing the warning signs, requesting an EKG from your pediatrician if your child has had instances of fainting or passing out or fluttering heart rate. Sometimes people can attribute them to anxiety attacks when they're actually, a heart issue that needs follow-up care. So we plan on doing more screenings in Northern California. We're having our first one back since COVID. Our last screening was January of 2020, and we're having our first one back this weekend up in Petaluma, sponsored by the Petaluma Healthcare District. And we're very excited to screen several hundred children this weekend, and we'll let you know how it goes. But important thing for parents to know is definitely if your child has any type of warning sign, like instances of passing out or chest pain during your following exercise or increased, fluttering heart rate, these are all potential warning signs. And your child can be perfectly healthy and active and all in shape. And the first sign of having a heart problem is often them collapsing with cardiac arrest. And when you collapse with cardiac arrest, you only have 3 to 4 to 5 minutes before brain damage starts to occur. And after that, you need defibrillation to stop the heart from the fluttering heart rate and regain oxygen, blood pumping to the brain. And so that's where CPR comes in. It helps to keep oxygen to the brain, and then a defibrillator stops that fluttering motion in the heart and allows it to regain a regular rhythm. And so when you do see AEDs out in the community, just know that they're very safe. They're extremely safe. There's no way to hurt someone with an AED. My 9-year-old can use one effectively. You just press the on button, it walks you through what to do. And there's no way to shock someone who's not in cardiac arrest. So it's a very specific heart rhythm that it reads and shocks. So that's all I have for you guys today, but I'm happy to answer questions at the end.
All right, and Liz, I'm going to ask you just before we move along, in what kinds of locations are those AEDs stored or available?
So we have AEDs, like Pamela said, we manage 350 just within the Sequoia Healthcare District boundaries. You can find them on pretty much every school campus within the Sequoia Healthcare District boundaries. We have them in shopping centers, police cars, libraries, community centers, youth centers, fields, playing fields. They're in all sorts of community locations like that.
Thank you, Liz. I'd want to call your attention to the information that is getting dropped into the chat. Jenny Bratton just shared, every year in the United States, approximately 4,000 children and young adults die suddenly and unexpectedly due to cardiac arrhythmias, but many are unaware of the causes, warning signs, and life-saving treatment options. That is a really important piece of information, and that's why the Sequoia Healthcare District feels so strongly about offering these town halls on a yearly basis. All right,
and it's actually, if you don't mind, I'm going to interject really quickly. There's actually some new evidence that shows that it's much higher than that. The numbers, it is difficult to record, who has and hasn't died of cardiac arrest sometimes because it's the heart stopping. But some new numbers have shown that it's much higher than that, and it can be the equivalent of a couple 747s crashing every month full of children in the United States, which is just a catastrophe, and we should be doing something to prevent that.
And let me just really quickly interject. An article I just read recently was talking about how some drownings could be probably attributed to cardiac arrest. But because the child drowning due to cardiac arrest, right? So drowning would be attributed as the death, but it could have stemmed from a cardiac arrest.
That's correct. When
right.
somebody like they are found dead in their bed, like they are, pass away in the middle of the night, a lot of times it's cardiac arrest. There's a syndrome called Brugada syndrome that happens when people go horizontal, which they do when they're swimming or sleeping. And there's a lot of car wrecks sometimes when somebody just drove off the road and maybe they fell asleep. Sometimes that's cardiac arrest as well.
I had never heard that it was the leading cause of death on school campuses. That is a sobering statistic.
Yes.
All right. Well, in terms of some positive action that you can take, we're next going to hear from Erica Lyons. And again, for those of you who joined us a little bit later, Erica is the CPR instructor for Sequoia Healthcare District's infant and adult CPR classes, which I think I heard are going to resume in person shortly. She's helped hundreds of local parents master hands-only CPR, and she's going to do a demonstration for us tonight. Can't wait for that. Erica, please join us.
Well, good evening, everyone, and I'm excited to be here for the second time. Yay! I bring the educational component to what Liz was speaking about. I also have school-age children. They're in high school, and one of the things that I really appreciate has been this ability over the past 7 years to get to know this industry, a little bit more about it. How I stumbled in was my nephew was a 17-year-old cardiac arrest survivor for 2 reasons that day. My mom had been a nurse for 55 years, and also a defibrillator saved him. So I instantly got involved, and wherever these little AED signs are, I always find extreme joy in that. So I bring the educational component to all of this. And one of the things I like to say to all my classes, no matter who I'm teaching, the power to save a life is in the palm of your hands. And literally, it's push hard, push fast, center of the chest, and you too can save a life. So I'm going to show you right here on Manny the mannequin, who's always the star of my show whenever I'm teaching. Manny's I've just got this, torso here, where the ribs meet, right here, I guess if you want to call it a nipple line, is where you would put, right here in the center, where you'd put the heel of your hand. Well, where's the heel of your hand? This is a heel and this is a heel. Very, very basic, but very, very, very important. So one hand here, I'm going to tilt my camera down so you can see what I do. And really, honestly, you've probably seen this on TV. There's no right way to lead with it. You can either lead with your left, you can lead with your right. The most important component though is making sure that you're in the center of the chest. Make sure that these elbows are stick straight. Push down more than 2 inches, 2 inches to about 1/3 of the chest depth at a rate of 100 compressions a minute. And I'm going to show that to you just real quickly. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Some of you who have taken a CPR course before, when you've gotten certified, maybe you've heard of the Bee Gees Staying Alive. You should see the 30-somethings look at me blankly when I bring that song up. They weren't alive yet. So it's simple, just like that. You don't stop. You can, if you're lucky enough to have a partner and switch off every 2 minutes, you can do that. If you're also fortunate enough to have a defibrillator nearby. Defibrillators are very important, as Liz was saying. They take a heart that's shaking and quivering, that's not pumping, and I like to say it smacks it into submission, and it gets it pumping again, getting that oxygenated blood through the brain, keeping the rest of the vital organs alive. And yes, you cannot shock someone who does not need a shock, but the most important thing is to pull it off the wall. If you have one available, grab it. They come in many shapes, colors, and sizes, but they do the one thing. They brought my nephew back to us. So how simple are they to use? You lift the lid. And by the way, before I start, you do need to take all the clothing off of someone. You listen to what the defibrillator tells you. Usually, actually in all of our models that we put out in the community, there's what I call a bag of tricks. And there's going to be scissors, some rubber gloves, gauze to dry the person off that might need if they're a little bit sweaty. Perhaps a razor, because sometimes people get a little hairy. We need to be able to make those pads stick. So how does this work? Everything has come off from the waist up. Necklaces, bras, everything got to come off. Lift the lid or turn the on button. Ideally, someone is performing CPR while the other person is applying the pads. So you listen to it.
Tear open package and remove pad.
So let's pretend I tear open the package.
Tear open package and remove pad.
But where do I put them? There's pictures that
Tear
tell me where to
open
put them.
package and remove pad. Peel one pad from plastic liner. Peel one pad from plastic liner. Peel one pad from plastic liner. Place one pad on bare upper chest. Place one pad on bare upper chest.
See where they are?
Place one pad on bare upper chest. Peel second pad and place on bare lower chest as shown. Peel second pad and place on bare lower chest as shown. Do not touch patient. Analyzing rhythm. Do not touch patient. Analyzing rhythm. Shock advised. Charging. Stand clear. Shock will be delivered in 3, 2, 1. Shock delivered. It is now safe to touch the patient. Start CPR. Give 30 compressions. Then give 2 breaths.
So the reason I wanted you all to hear that tone was because every defibrillator model trainer unit I use gives a metronome. So even the most, I would say, 3rd grade and up, all the way can use this. It's when I was learning about all of these, I had a 3rd grader. So it was very relevant to me. I encourage everyone to get out there and learn about this because it will save a life. It may even save someone that you love like it did for me. And it really does make a difference. We've got to get more people out there learning about this. We don't know all the effects yet of COVID on the heart. And the more people, I like to say every person that comes in my class, it's one more person that's out there ready to save a life, regardless if it's someone you know or you don't. So get out there and learn how to save a life. Thank you.
Thank you so much for that, Erica. That was a powerful demonstration, and your story of having this affect you personally is really powerful. As Jenny also posted, one study shows that bystander CPR was associated with nearly 8 times greater likelihood of sudden cardiac arrest victims surviving to hospital discharge. So I'm assuming getting to the hospital and getting additional help. Wow, that's amazing. Erica, can anybody do that? Do you need to have somebody familiar with that machine to use it?
No, it talks to you. Every model I've ever worked with, it just needs a brave person to pull it off the wall and use it.
And how do people get brave? I mean, is this something that it takes a little bit of, I don't know.
Well, okay, me personally, when it's somebody I love, I completely, I'll lose it because it's somebody I love, but my hope would be that someone who could hold it together would be there with me if it was a loved one that needed me. It may be that your role is coaching someone else if you just can't handle the action thereof. That comes up a lot in my classes. And, you know, I guess for my mom, it was special because she had already been a nurse and she took herself out of grandma mode and put herself into nurse Bonnie code mode. That's a very, very different special situation. I'd say just be brave. When I've taught in schools, I just tell everyone, be brave. You can do this. I would have no problem doing this on a stranger, even with COVID, just because I know I don't have to put my mouth on the person. I call it cooties free CPR. Gone are the days, unless you want to do it, that's great, but I'm not sticking my mouth on anybody I don't know. And so, you know, just, you can even we can leave the person's mask on and push down 100 times a minute. That's easy. the way I teach it, we've taken a lot of the math out and really simplified it and streamlined it.
Thank you for that, Erica. Liz, you mentioned that you could tell us a little bit about how liability concerns may impact using that machine.
A lot of people have concerns about liability and using a defibrillator on somebody. It's important to know that there is a California Good Samaritan law that protects those who use AEDs, as long as you don't do anything grossly negligent or out of the scope of your training. So you don't give them an emergency tracheotomy with a pen or throw the AED at their head. You're safe from liability. You're protected. Business owners have to follow a few simple rules in order to protect themselves from liability. But using an AED is a volunteer job. It's not something that is in your job description that you have to do, unless of course you're working in a hospital. But that's why it's protected. So I don't want anybody to ever be concerned or worried about using an AED. That person is technically dead. Their heart is no longer beating. They're no longer getting oxygen to the brain. And so it's hard to hurt someone more than dead. And so getting an AED on somebody, even if they're pregnant, even if you're not sure if they're having cardiac arrest, because the AED will read that heart rhythm and it'll only emit a shock if somebody needs a shock. So yeah, definitely grab the AED off the wall and use it.
Can I interject really quickly? I actually was not familiar with what an AED device looked like before I came to the healthcare district. So I would encourage you all to, to locate the AED at your workplace and at least, look for it, know where it's located, so that if in case you do need to use one day, you know exactly where to go instead of looking for one.
There's a couple different models here. They're all about the same. They all have an on-off switch and they all talk to you. And they all are biphasic and will read the heart rhythm, and they're all FDA approved. So there's several different kinds, but they all work the same way.
So Liz or Pamela, is the cost of these AEDs covered by the government or a healthcare district? What if a business wants one or a independent small school wants one? What would you do?
Yeah, I can answer that. So with our Heart Safe program, when we launched this, it was our goal to have them in all community spaces. There were guidelines that 6 seconds apart, 15 seconds. It's been a while since I remember now, but we would support the cost of those. The district would support the cost of those. They were at that time around $1,500 for an AED. I think they're around $1,200 now, and that would include the little, what did you call it, Erica? It was the little kit that comes with it. I like what she called it though. That was
the bag of tricks.
The bag of tricks. So that comes with the bag of tricks, and it would come with training. There were guidelines around who needed to be trained and how many needed to be trained when we placed these, and that was an important part that we did. So the district supported those. We paid for those. But to your question, Charlene, it would be for schools and for community locations. If a business wanted an AED, we would charge them, because we can't give public dollars to businesses, correct?
Right.
And so, but we would work with them and we would encourage them to get an AED and to get trained.
All right, thank you. Here's a practical question. Does the AED require pre-charging? Do you need to connect to an electric outlet to use?
I'm happy to answer that one. So the AED comes with a battery installed and 2 sets of electrodes. All the AEDs have at least 1 set of electrodes. Via Heart Project always puts 2 sets in there, so you have a backup pair. But they all have a battery that has a certain lifespan on them. Some are 2 years, some are 4 years. Same with the electrodes. So they do need replacing. And you buy those from, distributors and manufacturers. Part of the program Via Heart Project does, we write grants to get AEDs into school districts and communities. People can also purchase them from us at a discounted price. And then we provide maintenance solutions for them, so people don't have to worry about tracking their expiration date on their pads and their batteries and everything. Instead, they just subscribe to a maintenance program and we send them out automatically. So there is some maintenance involved. It's not just the cost of the AED. You do have to think about pads and batteries for the life of the unit.
Thank you so much, Liz. That's really helpful. Wow. Okay, so switching back to heart health for a minute here. Dr. Griffin, again, I think Liz, you might have answered this a bit in the chat, but it's a good question. I want to ask it. Can children grow out of having heart issues? Can you talk about that for a minute?
I guess I would say it depends on the heart issue. There are congenital birth defects that in general, I'd say most birth defects of the heart, which comprise about 1 in 100 children who are born, are pretty mild and are pretty, they don't really interfere too much with the child's life. You know, they just need to be monitored as they grow primarily, but they don't really cause too much trouble. I think when we're talking about conditions such as inborn errors of metabolism or channelopathies which cause arrhythmias, congenital arrhythmias, you really don't outgrow those. Sometimes they get better at times, they kind of wax and wane. So they may be more difficult for the patient during certain ages. But for the most part, you don't outgrow them. So that risk sort of always is there. It's a small number of patients, but it's still a significant number.
You know, I had not 1 in 100 sounds significant. Are all newborns screened for heart anomalies?
Well, actually, it kind of depends on whether you want to define as screening. You know, I think a lot of people get prenatal ultrasounds nowadays where they look at the structure and the function of the heart. And so as a result, they do, you know, kind of get screened for severe congenital heart defects. About 1 in 300 congenital heart defects actually require some kind of intervention in terms of surgery or pacemaker or those kinds of things. So there's, and it all can depend on how things unfold over the course of their life as well. So it's really important that they get follow-up during the course of their, you know, athletic career, for instance, if it's a student athlete, or just during the course of growth.
What I understand, Dr. Griffin, I have a question. Years ago, they started doing the pulse oximeter on infants when they come out, and that is measuring the oxygen levels in the blood, which can be indicative of a heart issue.
Right.
And by doing that now, for every newborn, it's cut down on instances of sudden infant death syndrome. The infants, you know, suddenly dying in the crib.
Well, I mean, it's actually a very helpful screening tool for ductal dependent heart disease, congenital heart disease. You know, I think sudden infant death is a little bit different because we don't really completely understand what causes it. And I think the risk is still there, even though they do the congenital oximetry. I think the congenital oximetry is most helpful for, you know, looking for people who have ductal dependent heart disease who are in the newborn nursery who might be masked, if you will, you know, and go home and then start to have problems pretty quickly after the duct closes. But it doesn't rule out congenital heart disease. So in other words, you can still have non-ductal dependent congenital heart disease that can be pretty significant. And so that's why we spend a lot of time seeing infants who have heart murmurs in the nursery, even if they've passed their congenital oximetry.
So Kim or Dr. Griffin, how does a infant or youth end up in your practice? Have they been flagged by a pediatrician, or what typically happens?
Well, typically there's sort of a, you know, I think the pediatricians are really on the front line. You know, they are listening to the babies when they're born. They are also seeing the patients for their well child visits. And typically they will hear a heart murmur, or they'll elicit a history of a chest pain or palpitations or, you know, some other cardiac complaint. And then those patients will be referred then for subspecialty evaluation. And the same thing occurs in young adults. So a lot of times, one of the biggest things is our patients who've had treated heart disease as they become adults and transition to adult care, they still need to have regular congenital cardiology care throughout their life.
All right, thank you for that, Dr. Griffin. Liz, it sounds like you have something to add.
No, I'm sorry. That was a few minutes ago. I'm good. Thank you.
Okay.
I have a question about that too. I had been asked that question around, do children grow out of this? Because I recall when I was teaching CPR a long time ago, that question would come up a lot, and there were various answers. And I had heard of a couple of kids who would have episodes of passing out, for instance, and they would show there's nothing wrong with the heart, but then they would just suddenly stop. And in their mid 20s or late teens, there would be other instances again. So, but then that reminds me of a question around what Liz's work is around these screenings, because a lot of the athletic screenings won't look at the kinds of things that Liz finds on these screenings. And so I wanted to ask a little bit more about that, just so that I think it's an important distinction between what's the general screenings that they get at the pediatrics office and then what Liz is doing and what you help with, Dr. Griffin.
Yeah, I mean, oh, sorry, go ahead, Dr. Griffin.
Yeah, so I would say, and Liz, you can chime in if you like, most of the American Heart Association recommendations are sort of a 14-point, history and elicited physical findings that sort of help define who's at risk and who needs to be referred for additional cardiac screening. I think what the real value that VIA and others provide is that they make it readily available to those who might not have ready access to it, and it's got done in a kind of a group fashion, so that way it's done quickly and completely, so that people actually can benefit from that. Which it turns out that in the age groups that are at risk, especially in the athletes in high school, they have they have pretty high barriers sometimes to getting regular care for one reason or another, because a lot of times we find that sometimes the patients that we identify haven't seen a pediatrician in quite a while because of changes in insurance or changes in their all kinds of different reasons, really. So I think that that's where it does, I think, serve what's been a kind of a surprise to me is that it's been very useful, but it really is, a little more, it's a little more detailed than what you'd get with a general pediatric screening. But it's certainly not a comprehensive screen that you would do in a cardiologist's office. But we're looking for the top 3 or 4 pathologies that cause sudden cardiac arrest in athletes and young children, which is hypertrophic cardiomyopathy, congenital arrhythmias, and essentially myocarditis. So the arrhythmias that are associated with myocarditis and cardiomyopathy. So those are the things that we're really trying to find, and those are the ones that comprise the largest percentage of kids who have problems when they're playing sports, or really in any activity, even not in sports for that matter.
Thank you for that. Could you just for those of on in our group that might not know what cardiomyopathy is, or
Right, so basically cardiomyopathy means a heart muscle that doesn't function normally. That's all that means.
And
myocarditis?
Myocarditis.
That's an inflammatory condition of the heart muscle itself.
And are there reasons that those people might have those? Is there, one is a lack of oxygen to the heart?
No, I mean, most of it is congenital. I mean, so it's something that you're born with. So, either it's a genetic condition that predisposes the heart muscle fibers to form abnormally, or it's an abnormality in the conducting system of the heart that that delays that basically sets the groundwork for an abnormal heart rhythm to get started in the first place, or it's a viral infection, just like we've lived through in these past 2 years. I mean, for my entire career, we've seen smaller numbers of patients who had, viral infections, which are kind of the more common ones, even influenza, adenovirus, Coxsackie, and enterovirus. They can all cause an inflammation of the heart muscle. And even in milder cases, which sometimes people don't even know they have, it can cause scars on the heart, which are kind of electrically neutral. And so that can be the basis for an abnormal heart rhythm to occur as you stress the cardiovascular system during extreme, like sports or exercise.
So Dr. Griffin, is that why we really don't want folks with AFib or other heart conditions to get COVID?
Yes. Yeah, because the risk of developing a serious inflammation of the heart, or even a heart attack for that matter, because of the clotting abnormalities and also the risk of an inflammation of the heart muscle with COVID, is like 1 in 5.
Yikes. Oh boy. Okay. Liz, you mentioned that you have a screening coming up. I think you said, teenagers. Erica, you have several. What is the best way to get a reluctant teen to take part in one of those screenings?
Bribery, I think, is the best way. But my 9-year-old responsible to that. So these heart screenings that we do don't take the place of your annual physical. And we always let people know it's not comprehensive. It is kind of a quick screening. It's not, what you'd get at a cardiologist office. So if your child is experiencing signs or symptoms, the best thing to do is take them to their pediatrician. However, anyone is welcome at our heart screenings. You don't have to be from that school district or that zip code. So if anybody wants to go to our website, viaheartproject.org, and sign up for their child to come on February 27th to Petaluma for a free heart screening, you're welcome to. It's a test that's worth potentially thousands of dollars and potentially a life. Children can be reluctant sometimes, nervous, I guess, because nobody's ever looked at their heart before. And sometimes they're athletes and don't want to, be pulled out of sports or anything like that. But I think when they're presented with, this is something that can only help you, it can't hurt you. And we have such a low false positive rate. We utilize this international criteria for reading the EKGs that brings the false positive rate down to under 2%. So when we find something, it's there. It's something. It's not, we're not finding things that are pulling kids out of sports for no reason.
And if you find
nothing.
something, does that kid get flagged and sent for care right then? Does that happen sometimes?
So what we do is the cardiologist at the screening talks with the child and their family if they're there, and if they're not there, they usually call them. And then Kim and Dr. Griffin have been wonderful at handling follow-up for us for our screenings. So Kim will then call each of those families that we did find something and talk to them one-on-one, and have them go to their primary care physician and get referred to a cardiologist.
So Charlene, can I jump in?
Sure.
The first place that I met all these wonderful people on the panel with me was when Sequoia Healthcare District put on the first heart screening in this area 7 years ago. I brought my son because it was, oh gosh, barely 2 months after my nephew's arrest that he had survived. And I can't speak enough about how wonderful Dr. Griffin walked me through the whole process, because we were coming at it from a very different angle. And I thought, okay, this is the most non-invasive way to find out. Unfortunately, I was not given, even though it's my brother's child, I was not given any information. And I'll never forget what Dr. Griffin said. He said, well, okay, so you don't have any information. We're just going to treat you like, you're adopted. You don't know anything about your previous medical history. So I was very impressed with the hand-holding and just the professionalism in which the screening was conducted. And my children were a little bit nervous, but nothing out of the ordinary. And so when you talk about the flagging, I've worked, and then I started working the screenings, and I like to think of when we find a problem at a screening, it's as a parent, we all go through so many different times where there's instant panic. I'd much rather have an instant panic than a lifetime of pain. And so it's really reassuring that, you know, it's a very good screening. And so that's all I'm gonna say, but they're fabulous.
One thing I thought I'd mention too, people may have questions about, you know, whether you can outgrow an innocent heart murmur. So in other words, many murmurs are innocent, and those can sort of come and go. And yeah, it's certainly possible that someone could have a murmur when they're younger. And if it's not caused by an underlying heart problem, which most are not caused by an underlying heart problem, then you certainly can outgrow it.
So Dr. Griffin, we talk a lot in the Sequoia Healthcare District about mental health, especially for youth. Is chronic stress, I'm sure what you're going to say, is chronic stress or anxiety bad for the heart? I know that often teens who have a panic attack feel like they're having a heart attack.
Well, I think certainly over the past 2 years, I think we've seen stress levels at an all-time high. And the way it manifests in our younger kids and teenagers is slightly different, you know, school age versus teenage children, but it's typically has some similarities in that, you know, yes, you have, you know, a fast heart rate that you don't understand why it's going fast. And sometimes it seems like it just does it out of nowhere. And those are all, you know, those are all pretty typical symptoms of that. And we've seen a lot of it, you know, because kids are isolated from their friends, they're doing distance learning, they're also confined, you know, with the distance learning, you know, so that they don't have any way to move about. And so we've seen a lot of that. And in conjunction with that, we've seen a lot of dizziness because they haven't been exercising or getting up even. And so as a result, you know, we've seen a lot of people that just stand up and pass out, you know, so yeah, it's been pretty wild.
Wow. Well, we are just about at the close of this wonderful hour. We have learned so much and want to thank all our panelists. And I want to give Pamela, perhaps you and each of our panelists, just a minute for some final remarks. Pamela.
Well, first, thank you. I still learn things every time I'm on one of these or hear from Erica or Liz or Dr. Griffin or Kim. I'm always learning new things. And one of the things that I think really inspired me when Erica is speaking is when she talks, I feel like, oh my gosh, we can all do this. We can all do this. And we should do this. But it is scary. So I feel like the next thing or the next campaign or the next important message I'd love to hear from those who tuned in today is how do we get people to be inspired to want to learn this? CPR and the AED that is so scary, and we see this thing around, but it literally does, it saves a life. And as Dr. Griffin had said too, we're seeing more and more concerns around this and maybe people wanting to step up and take action. So any ideas where we can re-energize or re-motivate people to learn, I want to hear. And I want to thank our participants and our panelists today, because this is something the district is heart safe, and heart health has been one of the first initiatives of Sequoia Healthcare District when we transferred the hospital. We had run a hospital and then we worked towards community health immediately after, and Heart Safe program was the first initiative of the district, and it's still going strong. And we've changed and things have moved around and such, but this is such an important concern, and it still is. It's not going to go away. We're all going to have these concerns, and I hope that we can they don't increase with stress and all of these other concerns and illnesses and variants of COVID and other things. But we're here and addressing it to the best that we can. And I appreciate our partners. And thank you everyone for being here tonight. Really important topic.
Thank you so much, Pamela. And Erica, a couple seconds for you for some closing remarks.
Get out there, learn how to save a life. It's literally in the palm of your hands. I encourage everyone, find a class. And if you have questions, seqhd.org.
Yeah, it's not hard to find a class. It's seqhd.org.
There you go. Thank you, Erica. We can see why you are such an inspiring instructor. Liz, how about you? You've given us so much information tonight. Final comments.
I just want to say, don't ignore the warning signs with your children. If you have children that have, heart issues or anxiety attacks or passing out, definitely follow up with that. And I would say, don't be afraid to use an AED when you see one. I know way too many parents who have children that have died from cardiac arrest. And my goal is to not know anymore. I don't want that to happen to anyone else. So that's why we do what we do at Via Heart Project. And we're so lucky to have Sequoia Healthcare District as a partner. And we're really happy to continue working with them over these years.
And we're lucky on the other side to have Via and Erica and Dr. Griffin and all of those we work with.
Thank you, Liz. You bring such passion to your work and it shows. Kim Griffin and Dr. Michael Griffin, I'm going to give you guys the final word. I think you're muted, Kim.
Please.
Start over.
I need to start over here. I know I was muted, but so don't forget to screen yourself. Your kids are important, but so are you. Starting at least at age 50 or younger, depending on your health or your heart or your family history. You should be have cardiac screening with a stress echocardiogram. Do not let anybody talk you out of that, especially your insurance company.
Yeah, that was really good advice, because insurance companies do that, don't they? Yeah. Thank you.
Well, thank you, everybody. This was a wonderful event. I learned a lot. And if Pamela says she's learned something too, I know we all did. Really appreciate you all being with us tonight for this wonderful event.
I just
On
wanted to
heart
thank
health.
the American Heart Association for sponsoring a lot of this, because I think they're really a great organization. They support doctors and patients as well.
Thank you, Dr. Griffin. Well, and again, my partner Bev has dropped in a link to a very short survey, like 4 questions. We hope you'll take a minute. We really read every one of your responses and it helps us to plan for the future. Again, thank you everybody so much for being with us tonight. Thank you, Pamela Kurtzman and Jenny Bratton and Sequoia Healthcare District for sponsoring this really wonderful town hall meeting. Take care, everybody. Stay well, get your heart screening, and we hope to see you again soon. Good night.